The conference was very smooth, and it looked at the whole complex of childhood obesity from all its dimensions. There were discussions on the governance issues, intersectoral action, how different parts of the government and the country and all sectors can work together, and what are the key actions that should be taken. We looked at surveillance issues, on how childhood obesity surveillance is being done in Europe. The Childhood Obesity Surveillance Initiative, for example, where for the first time we even saw comparative data on southern European countries, discussed methodology, but also discussed the implications for policy. We looked at prevention of childhood obesity, which is, of course, given the size of the problem and the momentum that we are seeing with the growth of obesity in the region. The real hope for Europe lies only in being able to control obesity from the beginning of life, from a life course approach that starts from childhood. And finally, we looked at also elements of the treatment of childhood obesity. We looked at the complications and the complex of consequences that childhood obesity has, even in the child's life, let alone for the future impact on their risk of chronic disease as adults. So all these four elements were represented by speakers that came from academia, that came from civil society, as well as practitioners. It was a very rich and very exciting conference. What to do on Monday? An important reflection, yes, the conference had a number of very practical suggestions. First of all, one has to congratulate Portugal on being one of the countries moving forward with fiscal policy and trying to control the consumption of sugar-sweetened beverages, at least provide an incentive to push or shift the population away from consumption of sugar-sweetened drinks among children. That is one of many examples that we saw in the meeting. We need research on how marketing is reaching children, how much they are exposed to, and what is the power of that marketing. Then we have to see how this can be regulated. We saw how self-regulation has proven to be ineffective across most of Europe, how it's important for the state to intervene. But in order for us to give good policy advice, we also need information as to how it is working. For example, in the digital era, we see that children are exposed to both television as well as their tablet and smartphone use from a very young age, from ages as young as below 5. Children are already going online and already being exposed to marketing. We saw the importance of providing good regimes of treatment and understanding. We still don't know what works in order to control childhood obesity at the clinical level for those children who are suffering from it. Does one target just the parents? Does one target parents and their children? Does one go for a whole family approach? Each has different resource and skill implications. It's important to experiment with different models and to understand how that can be done. Absolutely, without a doubt, on the regulation side. So all the evidence that we have seen at this conference suggests that yes, there is some impact from efforts to persuade, to raise awareness, or to nudge, but this is minimal and will have no impact on the trajectory of the epidemic at large. it's extremely important to go down the structural side, to create the environments where families can make healthy choices for their children. Now, this involves, I made a presentation myself where I drew the parallels between tobacco, alcohol and foods, and I hope to have made a strong argument that areas that have worked in those other two themes, tobacco and alcohol, have a lot of relevance to sugar and trans fats and fats and salt in the field of diet. So price, marketing and availability and regulations on those three are important. Food product reformulation is another area of where a lot of experimentation is possible. Elimination of trans fats. So there's a wide range of environmental interventions that a public health institute could investigate and build the evidence base for.